Welcome to Thrivecast, your voice for social and emotional well-being. I'm Nathan Ash, and I'm joined here by Prizila Vidal. She is one of our Family, Youth, and Roundtable Outreach Community Liaisons. She's also a diva extraordinaire. And what are we going to be talking about today, Prizila?
Well, as we know, or you should know, this month is HIV Awareness Month, and pretty much June 27th is National HIV Testing Day. So we will be talking about some resources and statistics on HIV/AIDS, and then we're also going to be talking about being at the fair this Saturday.
Yeah, so what are we going to be doing at Del Mar Fair here in San Diego?
Well, coming on board, one of my biggest jobs that I'm trying to do is get the Family Youth Roundtable out in the community so people can know who we are and what we do and why. And so at the fair, we're just going to go and meet and mingle with different other agencies and get more information and, of course, have fun.
Awesome. And so what are some of the activities we're thinking about doing at the Del Mar Fair?
Well, one of the activities that we came up with was that we were going to do like a little section of Thrivecast, and so we want people to get on a raffle. I should have brought an example of the tickets that I printed out. You're probably going to like it.
I saw those, yeah.
Oh, yeah.
Yeah, so, you guys are working on it.
Yeah, so we're going to do like raffle tickets, and people can like fill out their information, and by the end of the day, or maybe the next day, whenever we get back to San Diego, we'll pick who is gonna come on the show and share their story, or whatever they want to do.
Because the most important thing is it's out at the fair, so it's specifically dedicated to the LGBTQIA community.
Yes.
And so by collecting those stories, we're hoping to just again continue the advocacy for what's going on there and the community and the alliance. What is important about that, Prizila? As somebody that does outreach, what's important about that?
Well, for me, it's pretty much about branding. I'm not trying to say that I'm in this agency to promote myself and that's it. It's more so it's trying to see how can I use what I know, my resources, which I'm the queen of resources, how can I use that for and with Family Youth Roundtable. And one of the biggest things that I really try to work on is on LGBTQIA, foster care, of course, and HIV/AIDS, but more so for the transgender community because it's something that is not really talked about.
No.
And for me starting my transition, that was something that I wish there was more information out there.
And we're going to talk about your transition here in a little bit. So let's go through the letters of LGBTQIA for our listeners so that they understand what that means. So the L is for lesbian, B is bisexual.
You forgot the G.
Oh yeah, G for gay. I go right to bisexual. That's just my theory that most men are bi. I'm just kidding. But then we have bisexual, transgendered, and then when we get to the Q's and the QI, there tends to be different. I've heard different things. So what are the rest of the letters?
Well, I hear people say also that the T is kind of like, well, to me, it's like transgender or transsexual. Because there's two stages. Transgender is when you're like in hormones and stuff, like transitioning, and transsexual is when you already had one of your surgeries, either from the top or the bottom.
Okay.
Like for me, I already had the top, so I'm transsexual. So LGBTQ is questioning, which was the biggest one, but now they're bringing back queer.
Okay.
Like a lot of people were taking that more like offensive, but now people are kind of like, oh, like weird, different,
Okay.
I is for intersex and A is for ally. Even though I have heard people say A is for asexual.
Gotcha. And I've heard that too, so I just want to be clear. I guess at the end of the day, it's whatever you identify with, and as long as you're being represented, right? Because those were people for a long time that were stigmatized. I mean, we know that the APA, the American Psychological Association, it was a disorder for a long time until people stepped up and started advocating for change. So we're going to talk about AIDS and HIV, but I kind of want to talk about transgender too, because that's something, if you look at the data, they are by far, they have a lot of trauma. You know, you and I were talking earlier today about a lot of transgendered youth end up in the streets and they have to turn tricks and prostitute to make money. And sometimes that means putting yourself at risk for sexually transmitted infections, diseases, AIDS, HIV. Talk a little bit about that. What is that? That's got to be a demoralizing feeling at times.
Yeah, because, not to put down on the trans community for shortness, but I know a lot of people and a lot of girls that are still in the business, escorts, prostituting, etc., etc. And I go to a very well-known bar in Bakersfield, which everybody should know what it is. I don't think I'm gonna say what it is, because I don't want any stalkers. No. And when I go there, people always tell me, "Oh, how much are you charging for the night?" And I'm like, at first I was like, I didn't know what they were talking about. But then they would tell me, "Oh, how much are you charging for sex?" And I was like, "Well, I'm not, because, I mean, me being HIV positive, I guess the way I view it as is that I can't really have sex."
Yeah.
And that was just always my thing, and also being raped. I never was really like sexually active. So, but it really also stigmatizes us.
Yes.
Because a lot of people like see us doing that, so they already see it as, well, you have it.
Right.
And me being transsexual and being HIV positive, people say that I got it because I'm turning tricks, which is not even totally true, know. And so it's annoying, but then once I know how I got it, it doesn't really like bother me anymore, but it is annoying.
But when you are out, when people are out there and they have to turn to prostitution, there is a lot of risk behavior going on. Do men pay? Do they prefer a condom, or do they try to deflect somebody using a condom, or do they pay more if they don't use a condom? I mean, you hear these things, but what's kind of the reality out there?
They pay more if you don't use a condom. The majority that do use a condom are the people that are married or have partners.
Okay. That's interesting. Very interesting. Okay, so let's get into AIDS and HIV awareness. Living with it, 10 years now, right?
Since 2005.
Since about 2005. What was going on in your life before you got the diagnosis?
Chaotic, because in 2005, about like in July, August, I emancipated from foster care.
Right.
On my own account, I ended up being homeless for 2 years. I just was really tired of the system, like telling you what to do, what not to do, and being put down. Because when you're gay, people view you as like leftovers. Yeah. And then I was struggling with going to college, not going to college, like, what to do. And then some of my friends, we were up in Hillcrest hanging out. It was my birthday, December 6th of 2005. And we saw a HIV mobile unit. And they told me, "Oh, you should go in there and get tested." And I was like, whatever. So I went in there and, they do like the swab. Yeah. And then like in 10 minutes, they told me I was HIV positive. And I was laughing because I was like, to me, you draw blood and you wait for like a week or two until they call you and they examine your blood. So they were trying to like, "Oh, are you okay? It's okay to be stressed out, to be freaking out." I was like, I'm not stressed out. I was like, if I suffer foster care, why would I this?
Right.
Yeah. But I think it really hit me the hardest in my late 20s. Okay. I think when I was like 23. I'm 27 now, but when I was 23, it's harder trying to date because like, I date people, and then like the second or third day I tell them, and they say, oh, okay, and I'll call you, to hang out.
Yeah.
And it just never happens.
It's hard to get a close relationship with somebody. But yet we have enough information out there to know that you can still have a beautiful relationship and still use protection and be safe. It's about communicating. What else?
And it's also the stigma.
Yeah.
I think if people really knew more about HIV, then they wouldn't realize that.
Okay, so let's get into that. What do they need to know?
Well, I mean, being HIV positive doesn't really necessarily mean that it's a life sentence, which I kind of always hear from people say, oh, it's a life sentence. And I say, no, life is a life sentence. In reality, it's like if you don't work, you're nothing. If you don't go to school, you're nothing. So it's, to me, life is a life sentence. Being put here and then suffering and being discriminated and being thrown in foster care for who you are, that to me is a life sentence, not being HIV positive. Being HIV positive, use condoms, my doctor says use a lot of lube so that way when you being penetrated, it doesn't rip the wall and there's no blood.
I wanted to elaborate on that because when we talk, in public health, we talk a lot about condoms and protection, but lube is not something that we talk a lot about. And for people that, whether you're a teenager for the first time having sex, whether you're a young adult, what about lube is important? One more time for our, why is that a significant thing that people should think about?
Because when you don't use lube and you're getting penetrated or you're penetrating somebody, it rips the wall and so you bleed.
Right.
And if you use spit, it does not work.
It doesn't work, right?
No, people would say, oh, I use spit or I use lotion or something. That does not work. Right. But if you use lube, it slides. So, And that's another good way to know. Because, I know a lot of my friends that say, no, if I use lube and it slides in, they're going to think I'm loose. And it's like, okay, hey, but, right. I don't know. People just...
And again, in public health, I think it's important that we talk about these things because people engage in these behaviors and sometimes they don't know that they can be exposing themselves to a potential illness or risk behavior by not having lubrication or thinking that spit's going to work, which again is a biological, product. So I think it's really important that you talk about that. When we go out, we do talk, you talk about that to the people when you're doing outreach. The other thing that I think is really innovative, and I've been actually taking out in the community myself, are female condoms. Mm-hmm. So show for the camera what a female condom looks like.
Pretty much a female condom is this, and it's self-explanatory. It has instructions in the back. It can be used both for male and female.
Okay.
If you eating out, the
if
female.
You're going down on a girl.
Yeah.
Right? So oral sex,
mm-hmm.
It has a dental dam.
Uh-huh.
And that way you're avoiding that transmission of during oral sex. And it also has a tube that goes inside the woman, so that way they don't have to worry about the man having a condom.
Yeah, and that's another big important thing. A woman always expects the man to bring the condom.
Right.
So in this case, if the man says, "Oh, I forgot to bring a condom," just take yours out and be like, "Well, I have mine." Just put it in. Go to the bathroom, like I always tell my friends. Go to the bathroom, say that you're gonna powder up your face, and just put it on.
Right. Well, so I've been taking the female condoms out around, or showing people a picture on my phone, and girls especially are like, "I didn't know that was out there. That's awesome. Where can I get it?" But when I look at where you can get it, you would think they would have it at every 7-Eleven and at convenience stores, just like they do condoms. But it's really rare to see.
Mm-hmm. Yeah, I don't know why they don't sell them. I'm assuming they must be a little bit more expensive. But still, it's very important. If you have, all the other condoms, 7-Eleven still everything that you're supposed to be quick stop.
Right.
Cigarettes, booze.
Right.
Why not? You know, man.
Condoms.
Yeah.
And when I talk to girls, they say, now that I know that's out there, I'm more likely to look for it. But again, if it's not readily available, that's an issue. Mm-hmm. Because a few of the girls that I talked to and women that I talked to said, I know sometimes I'm going to be, maybe it's going to happen, or there's a potential that's going to happen if I'm on a date or if I'm with somebody. So, but I feel I'm not going to go to condom because people are going to look at me a certain way in the store. They're going to think I'm a slut or whatever. Mm-hmm. But if they have the female condom, it reduces that stigma.
Yeah.
And I think, one of the things that we need to advocate in our public health is these needs to be at the quick stops. Mm-hmm. So that women know that they're available. The other thing is, I over 20 different women I've talked to over the last few months, and men, actually, they don't know what a dental dam is. And that blows my mind because, it shows that we're not educating the public on the protections that they can take to minimize the spread of AIDS, HIV, STDs, etc. Because, one, it sounds like we don't talk about it in school. And anything when it's contraceptive related to women that's not the birth control pill, oftentimes it seems like it's not part of the conversation. Mm-hmm. And yet, even if you're on birth control, you're still at risk for sexually transmitted infections, diseases, however you refer to it. And what is the correct? Is it STI or STD? Because I hear different things in the community too.
I'm gonna sound stupid on air, but I'm gonna say this. I've been saying it in my head. What does STI stand for?
Sexually transmitted infection.
Oh, well, no, I hear more STD.
Okay.
Sexually transmitted disease.
I hear younger kids use STI, so sexually transmitted infections, and but I hear STD a lot. So you hear both, so we'll refer to both for the show.
Well, I mean, I always thought STD, but I'm old, so.
Right. How has AIDS and HIV changed from when, over the 10 years, have you seen a change in the public perception of AIDS and HIV?
No.
No?
No. I hear people say, "Oh, you have AIDS, huh?" I'm like, "No, I have HIV." And they're like, "Isn't it the same thing?" I say, "No, it's not the same thing."
So let's talk about that. What is the difference between AIDS and HIV?
Well, if you get infected, usually the first step is the HIV, and then is AIDS. But in some cases, you can get AIDS first, or AIDS, which is the full-blown AIDS.
Full-blown AIDS.
Mm-hmm.
So HIV is the precursor?
It's like HIV is a virus.
Right.
And AIDS is when it's already attacked your whole body.
Your whole body. Okay, got it.
Mm-hmm.
So, that makes sense. When we look at statistics, we know that over 1 million people are living with HIV in the U.S. Mm-hmm. 1 in 6 living with HIV are unaware of their infection. Mm-hmm. About 1 in 4 new HIV infection is among youth 13 to 24, and most of them do not know that they are infected. That's pretty significant. Mm-hmm. And that's why the work that you do, not only for the Family Youth Roundtable, but also the individual stuff that you've started throughout the years, you're one of the most resourceful people in our community when it comes to foster care, when it comes to advocating for LGBTQIA, and when it comes to AIDS and HIV awareness. I'm so glad that you're in our community, and I'm glad that we have you on this team because watching you and your passion inspires me. And I love what you said is, I'm not here either to promote myself. You're not here to promote yourself. What we are here to do, at least in my mind, is to support the populations, the family, the youth, the underserved that I feel we serve. And if we're not out there talking about these things, who is? Mm-hmm. Now, just by showing women about the female condom, every one of those people probably told somebody else, and it just continues to get the public health information out there the more that we talk about it. And sometimes we do have to use our personas and our ego to get to advocate and to kind of push these initiatives forward. When you first started this, you have the positive directions, right? Sorry. What is that?
Positive Directions is a support group. I'm gonna start crying, but when I first got infected with HIV, I went to the Child Mother Adolescent program, which is in Hillcrest, and the age limit is until you're 24.
Okay.
And so the support group let me stay on until I was 26. It was very fun. I loved it. Everybody knew me there, and it was kind of awkward because there wasn't really that many females there. And once I had to leave, I was really upset. I was pissed, and I felt betrayed because they were my family, and whenever I wanted support or talk or just go and sit down and hear people, I would always go in. And support is one of the biggest aspects in anybody's life that is going through any crisis, whether HIV, breast cancer, whatever. So when I was 26, I tried going to other support groups, but it wasn't the same. Some had age limits, some were just too I just didn't like it. So then when I was what was last year, 2013?
Right.
Yeah, it was before I was 27. I went to I was researching places to see who will allow me to host a support group. Because a lot of places saying, "Oh, are you a doctor?" Blah blah. And I'm like, "No, but I know everything about HIV." But they still didn't want that.
I live with it.
Yeah,
you know what I mean?
It's kind of like I'm HIV positive. Like,
are you a doctor? Is this what you need to know about AIDS and HIV? No, I live with it.
You know what? I always hear people say that they'd rather work with people that how can I say this? Like for me, I rather hear. How can I say? I don't know how to say it. I listen to people that have the same similarities as me instead of somebody that's just teaching and preaching.
Right, and I get that. It's just like a lot of movements. If you haven't been in my shoes, you're usually coming from a medical or a clinical or like in public health, the statistics and awareness. But living with it is a whole different reality. Mm-hmm. And but it also shows the stigma that even though you're not a doctor or you haven't studied this, that was something that actually prevented you from getting advocacy or being that advocate. I mean, obviously you're one of those people that you just stand up and you do it, which is what I respect the hell out of you for, because when you see a need, you make sure it happens. But how demoralizing was that they even ask you that question? Are you a doctor? Or do you have a degree in it? You know what I mean? That to me is ridiculous. Yeah,
I mean, I hear that from everywhere, even when I try to do something with LGBT foster care. We were at the meeting yesterday. I just wanted to say something, but I was like, I'm just not going to say anything. Calm down.
Right.
I will say something when I have to, but eventually I will say something to that lady. No, so in October, I found one place that told me to come in and share my proposal. It was Christie's place, which is on 3rd and Laurel Street, kind of by downtown, Bankers Hill. And so I sat down with the person that runs the program, and I was very nervous, but I knew what I wanted to do, and I knew that if it's something that I really wanted, I had to really own it.
And when I also notice with you is you don't start something unless there's a need.
Yes.
You're very strategic.
Mm-hmm.
And that's important because a lot of times we start initiatives without being strategic.
Or a purpose.
Or a need, or assessing what the true need is. Mm-hmm. Right?
And the reason why I wanted to do it, and they asked me that question, they're like, what makes your group different than other groups? Mm-hmm. And I said, because my group is not going to have an age limit, number one. Mm-hmm. Because every group has an age limit. Number two, it's not only for people who are HIV positive. Mm-hmm. I want it to be for their loved ones.
That's huge. And first of all, for people that don't know, what is Christie's Place?
Christie Place is an HIV positive agency, primarily for women, but they do provide services to men. Not that many because it's solely female.
Okay.
And at first I kind of thought, well, I'm not a female, so I kind of thought they were gonna like look up, look down on me, but they didn't. I submitted the proposal, and a week later, she said, "Okay, we're gonna start in November," and I was like, "Oh." In my head, I was thinking next year. I wasn't really thinking like, let's start right away. I was thinking, oh, next year. So yeah,
Right.
so I started in November, and it's been like what, 8 months.
Okay.
So yeah.
What's the experience been like?
Mm, it's been good. I get to hear people's stories. Their own. Everybody has their own journey, like their own like shoes that they walk in, and everybody's different. And I hear some people's stories that I kind of went there on that path or that road or what have you, and it's very nice to be able to help them and give them advice and try to help them like whatever they're going through or they need help with. I try to.
I think you're innovative because the fact that there is no age specific, that's becoming a practice. I know that Cleveland Clinic, for instance, is doing doctor's appointments for women, and they have, 20-year-olds, mid-20s, 30s, 40s, 50s, all the way up, and it's like a cohort that it's a pilot that they're doing, and they're having their medical appointments with a doctor, but as a group. They meet with them individually for a short amount of time and then as a group. And one of the things I think is innovative about not having an age limit is it allows people coming in at different points of their life and their life cycle, living with AIDS, HIV, or HIV and AIDS, I should put it in the right context. They can ask questions. Like when you first got this and you have a new person coming in, I would imagine it creates a peer support, which is again from Family Youth Roundtable. We want to inspire people to ask these questions, and we're more likely to talk to somebody who's in our shoes or has been in our shoes than a clinician or a doctor or a professional running a group, right? And so what has that experience been like with the different ages? I mean, do you see kind of a peer model developing?
I do. I noticed that a lot of the older people, even though they had it for like longer than me, of course, um, they still need help and they still are still kind of stuck. They're stuck on when they first got diagnosed and they haven't moved from there. Like they just still can't believe it. And one question that I always hear is, why me? Like, why? For me, I just never really viewed it as that way. I guess I always go throw this in there because this is why I kind of became who I am and became strong is because, I went through foster care, and to me, even though I don't know how the Hitler camp was, that's how I feel like it was for me.
Right.
So it really made me be strong. And hearing no after no, oh no, you can't do that. Oh no, this and that. I kind of said, well, F this, I'm just going to do it anyways if you say no.
Yeah.
So I just never really stopped and I just never really asked people for permission. I just do it.
One of the things that always sticks with me is a conversation you and I had one day, and I talked about your transition and becoming Prizila, and you said something to the effect of, I was able to put that in my past, put that in the past and just go forward when I became Prizila. What was that like? Because you entered into a different state, so to speak, or state of mind. That had to be tough.
Yeah. It was always hard, like, like waking up, looking at myself in the mirror, and when I was, I will say what my name was Jose. It was really hard because I knew that that's not who I was, and being reminded all the time, it was the hardest. So then, once I started my transition, I kind of went back and forth. I started when I was 18, and then I finally restarted again when I was 20. And I wasn't on hormones or anything, but I was Prizila. I don't know. I just was scared of the hormones at the beginning. Like, what is it gonna do to me? Because I'm HIV positive. So it was, I'm not really allowed. Before I start any medication, I have to ask my doctor.
Yeah.
I have to make sure because it's different. So I take injections. So then the first step for me besides the hormones was when I changed my name.
Okay.
Was when I was like, okay, this is real. Like I'm about to change my name, and I always went by Priscilla. It was a name that I had. When I was young, I saw this Australian movie, Priscilla, Queen in the Desert. So, I said, oh, okay, I'm one of those. I'm Priscilla. So that's where I got my name. And then I never really been very big on, like, surgeries. Like, I don't believe in surgeries. I'm, like, all natural. Like, excuse me, like, I don't want to change anything about me. But one of the main reasons why I was on hormones was for my breast. And, finally, like in January this year, I decided to like start looking and doing, my surgery for my breast implants. And, after research, finally on May 15th of this year, I had my breast implants. And, it's been very nice. Like, I feel better. I feel more confident. Like, I don't know. I just feel alive. I don't know.
You feel more who you are?
Yeah, definitely.
That's awesome. One of these shows I want to talk about what transgendered youth go through when they buy. I talked about this as they'll often go down to Tijuana or they'll buy the hormones off the black market, and there's
from other people.
Yeah, there's a lot of danger to that. There's a lot of stigma to it too, especially when these I think the show The Fosters, in one of the episodes they had a foster care youth that was transgendered, and that's what she was doing, is she was getting hormones off the black market or from friends, and that can be deadly. We don't even talk about the trauma that they go through when they're sexually exploited, but then also just trying to be who they are. So one of these days when we talk about foster care, I really want to hit home on that and the ways in which kids and youth go about obtaining them, because I think that's important. I really feel like there needs to be more education and support for them, and that whether they're in foster care or not, but if they're a youth that's going through that we educate and that we walk them through this process safely. But again, today's show is on AIDS and HIV. What in San Diego, what are some of the programs or some of the resources that are available in our community? And then nationally, let's talk about some of those initiatives too.
Well, okay, so the programs that I really love is family health centers. That's one of the biggest ones that
Awesome.
Yes, they are. The one in Orange Park, to me, is the best one. I don't know. The one in Orange Park is the only one that offers transgender services. Okay. So that's why I kind of was more keen to go towards them. But definitely family health centers are everywhere. Lead the Way is an HIV agency that does testing there, and it's on Park Boulevard.
Park Boulevard?
University Park Boulevard. That's another place that I really, really love what they do. And they do a lot of mobile testing in Hillcrest.
Although I think sometimes we stigmatize Hillcrest too.
Yeah, it kind of
our whole community is, we have it integrated throughout our community. But you're right. I think that's kind of our hub here in San Diego. Every community has
their own.
The gay hub. In Cleveland, where I grew up, it was Lakewood. And it's where you lived, and it's actually where you were accepted. And that's important for community, especially living LGBT. But also living with AIDS and HIV. And again, I hate to say that it's all, we tend to put AIDS and HIV, or HIV and AIDS with the LGBT community, but it's everybody. The statistics tell us that it's not just the LGBT community. And
that's another big stigma. It's like LGBT, HIV. It's like not even, like,
right.
But
again, unfortunately, I think it's more that the LGBT community has been at risk because, again, they've been kicked out of homes. They've been, maybe not supported the way that they should be, and then oftentimes they're in streets or they're in risk positions. more so than, quote, the general population. But if you look at some of the statistics, we see that, African American women, 25, single, 25 and under is another risk population. We're starting to see these emerging trends in the heterosexual community. And then there's a whole other thing that we don't talk about, which is men that say they're heterosexual but engage in homosexual acts, whether it be at bathhouses or porno theaters or, adult bookstore theaters, that oftentimes are putting themselves at risk. I had a friend who ended up getting AIDS. He had mental health issues and also really didn't know that he was putting himself at risk. Mm-hmm. And when he first started getting sick, the people around him thought he had cancer. I actually was doing outreach with a young man that passes out condoms in these places and had seen him and kind of knew. But again, it's one of those things where it's his confidentiality. We don't talk about, and I didn't know. I didn't want to say anything because I already knew he was living with the stigma of mental health. Unfortunately, he passed away very quickly, full-blown AIDS. And it makes me have regret that we didn't do more outreach in some of these places. Where are some of the, quote, darker places that you've done outreach or where we need to do outreach?
I go to bathhouses. Mm-hmm. I go to the clubs, like if I happen to go to one, most clubs nowadays do have free condoms. I've seen that a lot. Good. And there's some places that don't have, I always carry some in my purse. But that's pretty much where I do. And, if I go and do like an outreach or something, I always take some condoms, just to give them out like candy.
I personally think from a public health perspective, at any of those facilities, they should have them there. Mm-hmm. I think we need to look at that a little closer because, again, you're putting people at risk. And if you have a male, and again, you see married men. My favorite thing when I was in grad school at Ohio State is we looked at sexual behaviors. And we used Craigslist. And we went on, and you can go on to Casual Corners and look at all the men that are advertising that they're straight, but they're curious or they engage in this type of behavior. Oftentimes they have a girlfriend or a wife, and if they're not using protection, they're putting their family at risk. They're putting their wife or their spouse, their loved one at risk. And again, I'm not saying that women don't do this, but it's very prevalent amongst men.
And I think it's funny how Craigslist says that. I've seen that because I did an article on it for my social work school that I'm going to right now. And it says there that no, risky behaviors can cause HIV right. or other STDs, STIs. I just think it's funny.
Yeah, it's probably some attorney that said put that on so you don't get sued.
Yeah, and it's kind of like, okay, like most people, they're not going to read that. Right. They just want to get off and that's it.
And exactly my point. And one, it's creating a marketplace for that behavior, but nobody wants to talk about it. Mm-hmm. That these risk behaviors are out there and they're in plain sight sometimes, and yet nobody wants to look at, there's limited focus on prevention, early intervention when it comes to taking preventative, using condoms, educating them. It should be more than a disclaimer on a web page. Mm-hmm. But yet it's not. And how many people don't even read that disclaimer? They go straight to, I'm hooking up. Mm-hmm. I really feel that from a data perspective, we really need to start looking at this behavior because it is a contributor to risk behaviors that can result in HIV, AIDS, other STDs, and not only impact the individual, but impact others unknowingly. Mm-hmm. And a lot of men are fearful of having tests, especially if they're married or they're in a relationship, because why would you need to get tested?
Of course.
Right? So then they don't get tested and they live with symptoms or they ignore symptoms. And again, there can be some really disastrous consequences for families and individuals. Mm-hmm. I think that's significant. I'm glad that your school had you do that. Because that was when I was at Ohio State and we did that, I blew just from an epidemiological perspective, looking at how significant it is in comparison to the other forums, you see that this is a pretty significant behavior amongst males and something that we're afraid to talk about. But again, if we look at numbers, we know that there's a need for intervention. Mm-hmm. As far as I also wanted to mention stepping stones too. Have you had experiences with stepping stones here in San Diego?
I haven't. I've been to family health centers, like I said, UCSD, the mother-child adolescent program. I've been to Planned Parenthood just to check them out, but I hear that they're not really so.
What about the Academy in Hillcrest?
The
LGBT?
Hillcrest Center?
Yeah.
I've been there too.
Okay.
They have a lot of good services. Definitely, I think that's a big like hub.
Okay.
Like, they'll
Stepping
branch
stone,
out.
yeah, stepping stones to me. So when I was the assistant director of an agency, we took men and women coming out of prison, and it was one of our providers that focused on drug and alcohol and addiction, substance use disorders, residential facilities, outpatient here in San Diego. I think they do amazing work because we also don't. One of the things when we talk about risk behaviors. HIV, AIDS, LGBT, in those categories, drugs and alcohol abuse is significant. I worked with a young man earlier this year in his 20s who was gay. His family were Catholic and they disowned him. He was basically groomed by older men, and they would get him hooked on. They got him hooked on meth, and the next thing you know, he's HIV positive and. He has a lot of aggression towards the situation. He feels like he was groomed and robbed. He seems to be coming to terms with it, but he said if I wasn't using, I probably wouldn't have been infected because I was smart enough when I was younger. It was when I got on the drugs that I started engaging in behaviors I hadn't. And he kind of said felt like he was liberated, like he just went out and did it all. And unfortunately, there was a price for that. But do you see in the community a lot of drug abuse related to risk behaviors? Or is that just a stigma that we talk about?
I think it's like half and half.
Okay.
Yeah, I mean, I haven't really ran per se. Like, I guess I don't really focus on that.
Okay.
To be very honest. I think I focus more on like people like, making sure that, they use protection or,
right. But we know if they're using substances, there's some substance use or abuse, and sex happens. It's, making sure that they have the right tools. And sometimes when you're living in the moment or you're under the influence, that's not even on your mind.
Oh, but especially when you're like drinking or drunk. I mean,
right.
Right.
Which is pretty significant. As far as looking at just general statistics, what are some of the ways that people can get infected so that we make sure that we're very, we put this information out there? What are some of the ways, obviously having sex with somebody who's infected, what are some of the other ways that people may get or expose themselves to?
Sharing infected needles,
right.
Which is mostly like if you're doing drugs.
An IV drug user, yeah.
Yeah, and also, I never really thought about this, but until today, you can also get it if you're sharing needles, if you're, like, doing hormones.
Oh, that's interesting.
That's not actually one of the things that they define, that they use the word drugs, like drug users.
So the hormones get kind of thrown into that category?
I would, because you know what, I'm thinking about it right now. I'm HIV positive, so if I use my needle,
right,
and I give it to her over here, whatever, then she's gonna get it.
That's really significant.
I just thought about that right now.
Yeah, well, we just added something to the list of potential right?
Yeah.
And that's good that maybe we separate hormones out from street drugs or whatever you want to call them, illicit drugs. That's pretty significant because some people may not even think about that.
I would think hormones is drugs.
Right.
I don't know.
But again, it's a specific type of use behavior. Mm-hmm. And when we talk about IV drug use, we're usually thinking of like heroin.
Drugs.
Right.
And that's a stigma right there.
Right.
Because you're thinking, oh, wait, it's only for drug users. Let me borrow your syringe over here.
That's my point. Yeah, we stigmatize it, and we actually may expose ourselves because we're not looking at all the potential means of distribution or exposure. it used to be getting drug, blood transfusions and stuff like that.
Yeah.
What are some and a mother can transfer it as well.
Breast milk, yeah.
And so, if we look at it, there, about 75% of the 40,000 new infections each year are in men, and about 25% in women. That's pretty significant. Mm-hmm. Here's the thing that I think when we look at disparities, about half of all new infections are amongst the Black community. I use the word Black because it's not about many people that are of color are not from Africa, so Black. Even though they make up about 12% of the population, so half of new infections occur within the Black population. But again, they only make up 12% of the population. That is pretty significant. And what do you think that's about when we talk about community and exposure? Is it that we're not educating in their communities? Is it because there's not access?
I think both. I think it has to do a lot with different aspects. Maybe, I don't know because I don't study this culture, but maybe in their culture they don't believe in that, maybe. Mm-hmm. Or maybe I don't know, I mean... It can be a lot of things. I mean,
that would be a really cool show, is to get a group of some of these populations and subpopulations and have a forum and talk about, what were some of the contributors to exposure. So again, the more that we can put that information out there to prevent it, that's really our goal here. Right?
Yeah, and I think one of the biggest one is that. Because I remember when I was back in high school when we had the sex education classes, they didn't really talk about HIV.
No.
They just talk about like pregnancy, abstinence, but it was never HIV. Yeah. Now that I think about it.
It's funny when they talk about when they did the pregnancy. Did you have to watch the video?
Mm-hmm.
I had to watch the video. I was in 7th grade for health class, Mr. Nelson's class, I remember. And when they pulled out the placenta, I thought he ripped out her lung. I had no idea. I started screaming, ah! And everyone's laughing at me because obviously I wasn't paying attention in class. But it's funny when you go through that. And they don't talk about condoms. When I was in school, they didn't talk about condoms either. They just talked about abstinence-based. And I think that's one of the things we also don't do with at an early age with kids and youth is to start talking about prevention. I think a lot of parents want to be in denial that their kids may be sexually active. But I can tell you I was sexually active at age 12. It was, dealing with my own personal traumas to prove that I was a man, actually, as a young boy. But, my mom, right off the bat, as soon as she saw that she educated me on it, and thank goodness she did, mm-hmm. But a lot of parents are afraid of it. So what are some ways that youth or individuals, when they find out that they are diagnosed with HIV, what are some good resources or means to go about telling people? Because it's got to be a shock, and it can't be comfortable. Mm-hmm. So what are some strategies for people, or things that they can, some tools they can have in these situations?
I would say to get counseling.
Okay.
Even though that's not what somebody wants to do. It's kind of like, okay, I'm HIV positive. The least thing I want is somebody lecturing me, because that's how it feels. Uh-huh. But if you're not like in the right mind, you will think it's to get rid of it. Mm-hmm.
One of the things that you do when we go out in the community and when I see you out is you just put it out there. Mm-hmm. And I've never, like when I first met you, I didn't know, but you just put it out there and I didn't even blink. I'm like, okay, cool. She's an advocate. Other people, I mean, what are some of the reactions because you do put your information right out there, and that's why one of the reasons I respect the hell out of you too is you don't care. You're an advocate. You're going to show your scars, and you're going to tell your scars. We were somewhere and we were talking about, religion, and you said something bad that had happened to you in religion, and I just was like, I love her because that puts people in a situation where they have to think. They have to question conventional wisdom and go, wow, that's pretty significant. But what have been some of the reactions? I guess what have been the good reactions first? Have you ever said it and someone said, oh, I do too, and came to you and felt like they could talk to you?
When I do, because I do a lot of public speakings. So when I say, at the end, people come up to me and say, oh, thank you for sharing your story. I never knew that existed or how impactful it can be on somebody. And some people say, "Do you really have it?" Because you don't act like it. Like you say like it's nothing, and I say because you know what? It's nothing to me.
Yeah.
It doesn't define who I am.
It doesn't control you.
It doesn't. It doesn't have to dictate my life.
Yeah.
Now I do like have to make sure that I live healthy and all that because, I have stomach problems and
Yeah.
body issues that I deal with, but some people always say that, oh, I want to get tested now, or what do I do? Or some people tell me, you know what, I've been HIV positive for like a year, or etc. And I didn't know that there was help out there.
And you're helping them open that conversation. So that's been the good. What's been kind of the bad that's happened when you've put it out there?
Oh, well, people say like, oh, well, I kind of figure because gay people are, or your kind is the fault because that's how it started, kind of stuff like that. But I just laugh because
but that pisses me off because it puts people into a box, and the AIDS, HIV, it's not in a box. It's worldwide, and people are exposed for different reasons. A lot of it is just lack of knowledge of exposure and lack of understanding of ways to be preventative. I mean, I remember talking to somebody and saying, yeah, I went on a date. They told me that they were HIV positive, and I was like, no way, I don't want to deal with that. And I said, why? As long as you're safe, you have an open dialogue, you take the right universal precautions, it's not like someone's going to breathe on you, sneeze on you, you're going to get it. But people have
touch you.
Yeah, and people have this belief of that, and in public health, it's just about universal precautions, being smart and having an open dialogue. What's been some of the ugliest things that have happened? Because that's where that stigma comes really, when we tend to put it in that box of, oh, you're LGBT, I assumed, right? Which is total BS. What has been some of the things that you're like, you know what? That just shows how ignorant or how bad people can be in these situations?
I have heard people tell me that I should die because it's people like you that the world is how it is. But I just laugh because I know that if I'm here in this world, it's for a reason. So I just don't really I don't look at it that way because I will tell you something. When I tried committing suicide all those years ago and I didn't die those times that I did it, it must mean a reason, so I just don't really view it as that way. I view it as like I'm here to help people, instruct people, guide people, and that's the way I view it as. And if nobody talks about it, then it's always gonna stay the way it is.
You just made me cry. No one should ever tell you that you should die. You have more life than most people I've ever met. When you walk onto a school campus, I see how those kids come to you. And if you're not on that campus, they have no one to come to. And, I know the word I want to use right now to someone that would tell you that. But F them, You know what? You live every day for the fullest that life can be. But you do it smart, you do it responsibly, and you do it as an advocate every day. And I wish we could clone you. Because there needs to be more people in this world like you.
Yeah, I mean, I just try, whatever I know, I share it. And, I just try to help others.
Yeah, those are the types of stigmas of why I'm here. Whether you have mental health, whether you're underserved, whether you're living with something that is a lifetime situation, you're still a human being. And at the end of the day, we're on this earth to help. We're on earth to help one another, and to carry each other through and to make the most of this experience. When I hear the things that have been done to you, it shows the bad side of our human existence. But I don't see it ever holding you back,
No, and that's one of the things that I'm really proud of myself is that even though I went through everything, it hasn't stopped me. I have always pushed and pushed, and I don't know what. I guess I'm hard-headed because I never give up.
I know you don't.
Like, when I want a job, I don't give up until I get the job. And people always tell me, you know what? We like you because you just never give up. I was like, well, yeah, because I want this job. Why would I give up?
Or I want to I want to meet this person, or I want to do this. With employment, HIV, AIDS, that's got to be a stigma too. When you've looked for work, or you've been working, or were you working when you got it?
Yeah, I have always been working.
How was that experience telling your employer, or did you tell your employer?
I told one of my employers, the first place that I told was a Mediterranean place in Normal Heights called Sultan Banu.
Okay.
Where we went to go get those drinks.
Oh, right on.
I told them because I was working, I was dishwashing. That was my job.
Okay.
Because I started my career dishwashing people and cleaning toilets. Okay, that's how I started. And so then I gradually was helping out, prepping food and everything. So then one day I cut myself.
Oh.
And so I was like, my reaction was, call the presses, call the police, And I was making a big deal out of it. And my bosses are like, why are you tripping for? Just clean yourself and that's it. I said, no, you don't understand. She goes, what? She goes, don't worry. And there was people in the kitchen cooking and stuff. And then I said, I'm HIV positive. And they stopped and they looked at me. And then she grabbed me and she took me to the back. And she goes, okay. She's all like, okay. Then she's like, no. She's like, it's not a problem for me. We'll just throw everything away and we'll just, work with it. She's like, and if anybody else gives you a problem in the kitchen, let me know. And they did. Some of the coworkers were talking crap, and because they didn't really know anything. They didn't know anything about it.
They're working from ignorance.
Yeah, and so I wouldn't say that that's one of the reasons why I left, but it was primarily one of the reasons why I left. But I know that it had nothing to do with my boss,
right?
And but yeah, other than that, I worked for the county and I told everybody, and they just didn't really seem to care about it.
But that's good that our county was accepting. And the thing that's important for people to know that individuals with HIV, AIDS are protected under the Americans with Disability Act. They cannot be discriminated against in their jobs. I don't think a lot of people understand or know that. But it's something that people should know, that you are protected under the Americans with Disability Act. And that discrimination, unfortunately, happens probably more prevalent than we know. But because I've seen it in other places, or people kind of talk in the corner. To me, that's discrimination.
Well, and it's also called HIPAA.
HIPAA, yeah.
Because if you tell, if I tell you and you tell somebody else and somebody else, that's HIPAA.
Right.
You're not supposed to be telling other people about somebody's...
Yeah, so-and-so's got... Right.
Yeah, and it's you don't do that. And when I went to medical school, I went to UEI at first. And we had to do lab. And in lab work, you have to draw blood from people. And I didn't want people to draw blood from me because I'm HIV positive.
Oh, wow, yeah.
So after weeks and weeks, the teacher told me that she was going to kick me out of the program, or she was threatening me to drop me in my points. And I pulled her aside and after her, look, the reason why I don't want to get drawn blood is because I can't. She's
Gotcha.
like, why? You need a medical's doctor note. And I was like, why am I HIV positive? Because it's you're going to get a medical, I'll just tell you why. She says, oh, okay. So then the next day, I come into class and all of a sudden everybody knows. And they come into the principal's office. And I didn't know. Okay, so I went to the principal's office, whatever. And the principal, whatever, said that I was threatening to stab people with an infected HIV needle. And I was like, I said, first of all, I said, HIPAA was broken here. He's all like...
And in school, it's actually FERPA, which is the Family Educational Rights and Privacy Act, and you are protected under that when you are in a school, whether it's a university or K through 12. So,
yeah. And so he's like, what do you mean? I said, I told the teacher that. I never told anybody that. And I said, second of all, I'm not that stupid to be saying that kind of stuff. So, I got kicked out of the program, UEI, and I only have 1 more week left, okay?
Oh, my goodness.
And so I started looking for other places where I can transfer my credits. And luckily, Copland College, I told them the situation straight out. I said, look, this is what happened. This is why I got kicked out. And they told me, you know what? It's fine. You don't have to do, draw bloods. People don't have to draw blood out of you.
Right.
We'll just tell them that it's a condition.
Yeah. And
I said, okay. And so then, after a few weeks, I got some letters from UAI saying that they were gonna sue me because I didn't pay for I think it was 2 or 3 weeks, but I wasn't even in the program anymore. And I said, look, I'm suing you guys for breaking HIPAA.
Yeah, FERPA too. Mm-hmm. Yeah, the federal education. But the audacity that they would ask you for money back after that whole scenario.
Yeah.
That blows my mind. You just prompted something in my head. I have worked at a number of organizations. I've also done audits and reviews at organizations, whether it's a consultant or within an organization or for organization. One of the things that you see often on a chart that somebody that has HIV or AIDS is serious medical condition, or it's flagged a certain way in their files or their record, which to me is still stigma. You're not saying AIDS, HIV, you're saying, oh, they have the condition, or oh, they're the red flag, or however it's done in that system. And then everyone uses that word instead of AIDS, HIV, which is still stigmatizing, and they're still treating them differently. And that is very prevalent within the medical field and within the behavioral health field, is they flag somebody with HIV and AIDS. They don't use the word. They call it a serious medical condition, or they have a term for it with a code word for it, so that, again, they don't violate HIPAA. But in their mind, it's to keep everyone safe. But if we just look at public health universal precautions, people can be safe. And I think that's a whole other issue when we talk about AIDS and HIV awareness, is there are a lot of systems of maintaining medical records or medical information related to AIDS and HIV where organizations use a coding system or a term or something to refer to it, and people are still stigmatizing. They're just not using AIDS, HIV. And that's something that I think people need to be aware of. That just because you're using a different word, the person on the other side of the counter or the person on receiving the services still knows that you're stigmatizing them. Mm-hmm. You can tell because the way that people act around you, I would imagine.
Yeah, when I was younger, I remember that when I used to go to the doctor, they're like, oh, you have HIV, huh? I'm like, yeah, in front of the nurse, and I was like, okay, whatever. Okay, put on some gloves, put on a mask. And I was like...
Put on our gloves.
And I was like, what the... I was like, I'm in front of you. That's just, rude, I was like, that's rude.
And you should be like, well, you have halitosis, so could you cover your mouth too, right?
It's like... I mean, I understand that's why you use that, but do you have to say it, all sarcastically? It's that's just rude.
Yeah.
You know?
What is some advice for people when they have to tell their family? How to go about it, because that's got to be so scary. And I've counseled, I've worked with people, and part of the reason that they either have a substance use disorder, or they're self-medicating, or they're in severe depression, or whatever, seeking support, is either the fear of telling their family, or the reaction they're anticipating. So what are some strategies for someone that gets a positive diagnosis when it comes to talking to their family?
I think it's always hard. It's kind of like coming out. Mm-hmm. It's ostracized. You get what's the other word? Outcasted. I forgot the other word.
Oh, you're like an outcast?
Who?
What you're saying, you get like kind of like.
Yeah.
I know what you're saying. So your
I'm
family kind of disowns it.
There you go.
Right, they disown
I always
you.
use that when I forget.
Right.
You know, I have heard different stories that people have done to let their family know. One person told me that he will leave his HIV medicine out so their family can look at it and see and read it or Google it. Or I have people told me that they will write letters to them.
Okay.
Or they will like Google it on the computer and leave it there on the history. So
I like that. I've worked with people and we've done the letter, because then it kind of externalizes it. They don't have to get in the direct dialogue, and it puts it in the other person's court to see how they come at you. But what the individual who wrote the letter and is living with HIV or AIDS is that they got it out. Living that secret or not being able to get out, the letter was a way to just get it out and just move forward. If not, I've heard people say it feels like a weight. I had a friend back home that is HIV positive, and he's heterosexual, and he said that the first thing everyone said was, "Oh my God, I didn't know you were gay." And he was like, "I'm not."
yeah.
And then it was, "Well, how did you get it?" It's like this ignorance factor that people have. They just make these assumptions. He just wasn't smart when he was playing, and he was in the club scene. Things happen. But, the thing that he was in denial for a long time. He just said, "I didn't have sex." And then I didn't want to tell anyone. And then finally he realized that it was becoming self-destructive, keeping it in. And so that was his obligation, to just tell people and become an advocate. But I hate to say, but we tend to put the LGBT label when we start talking about HIV and AIDS. And that, to me, is costly, because then people are assuming, well, that's not me. And then they end up getting it, and then that's a whole other issue. As far as what do you need to do to be healthy living with it, what are the things that you do to live healthy with it?
For me, I eat healthy. I take a lot of vitamins to make sure I don't bleed. I exercise, even though I'm a little bit chunky right now, but...
Yeah, you and me both. I got done with school and I need to go back to the gym.
I know, me too.
Maybe we'll start working out together.
Yeah, that'll be fun. I just try to eat healthy, and everybody's different. Like, you will know what works for you, what doesn't work for you. And it's pretty much knowing, like, what you should avoid, and, it's pretty much just ask your doctor and see. I
was going to say, talking with your doctor, having an ongoing open relationship. When it comes to the medicines, because we've seen, taking medication a lot of times when you have AIDS, really harsh on the system. At least they used to be. Is that changing, or are the medications changing? What's the kind of the regimen, Well,
medications always changes. There's different... Honestly, as far as medication goes, I wouldn't really know too much because I'm not on medication.
Okay.
I'm under a study, and I take a AAA, which is a medication that's like 3-in-1.
Okay.
And I take it before I go to bed.
Okay.
So it just depends. Everybody, HIV is different.
When I was working prison reentry program, we'd have people come out that were HIV positive or AIDS, and they didn't get Medi-Cal. And their medication sometimes could be $1,500 to $4,000, and they didn't have the money to get it. And we would have to call all over the country to get money for them. But then we started finding out about local programs that actually had provided at a reduced cost. What are some of the do you know some of the resources that are out there?
About
for medication assistance?
I know that's something that's always kind of hard, but I don't want to say this and then I'm wrong, but I know that if you go to the Mother and Child Adolescent program, they'll get you with Ryan White.
Okay, Ryan White, that's the federal legislation, right?
That's one. Before it was LHIP, which is low income health program. Now,
now people get through the Affordable Care Act. They can get right into Medi-Cal or Medicaid, if it's outside of California.
But if you're HIV positive, you get into that pretty fast.
Right. Do you know about the Ryan White law?
Yeah.
Okay, so talk a little bit about that for people that don't know what that law is. And that was under Ronald Reagan, I believe, that passed, right?
Mm-hmm.
Okay. So what is the Ryan White law?
Pretty much, it was a kid who one of the first kids that was diagnosed with HIV when he was in school, and then he died, and so they decided to make like like a like a like a medication thing, like to
A policy.
There you go.
Yeah, it's a federal policy.
To try to get people to get temporary assistance. Is not really like it doesn't really cover a lot of stuff. Some medication it won't cover, but it's a starter.
And housing too.
Mm-hmm.
That's one of the things that there was an article not too long ago that I was reading, and then I started looking at the data. There are individuals that have actually been on the streets that when they kind of realized that if they got HIV, it actually was a way to get off the streets because they couldn't get, Medicaid or Medi-Cal or assistance. The term I've heard is getting a kitty, because it meant you actually got off the streets, you got a housing, and you got support, and that tells you how bad the problem is. Mm-hmm. To get off the street, you have to expose yourself to an illness, and one of the things with the Affordable Care Act is now people don't have to do that, and we need to get that education out there. You're actually going to get certified, hopefully here with Covered California, so that you can actually do outreach and get people covered, right?
Yes, that's what I want to do because a lot of people don't. The whole insurance, medical is a pain.
Yeah.
I have been really lucky about it. Every time that I have to change my medical or whatever, I go to my ex HIV counselor, even though we're not even. He does not even.
But you still maintain that relationship.
Yeah, because he will tell me like, oh no, that's not right. You should go say this or that. So pretty much like he guides me, and that's how I do it. Because I don't know nothing about insurances. I'm like, just give me medication.
So I see that you've taken notes. So I know you're going to do research, and we'll do follow up on some of these things that we opened up.
Yeah.
I'm glad that we had this conversation because now we have some new initiatives to add to our, I call it the Batman utility belt of prevention and early intervention. What would you like to leave the listeners with?
I would want to say, when in doubt, just get tested.
Yeah.
It doesn't mean anything if you are or you're not. I mean, you'll go from there. And, just tell your friends, tell your partners, let's go get tested, If it's easy for you to say, let's go have dinner, let's go for a walk, let's go for a run, whatever, and just say, hey, let's go get tested.
And let's use a condom. Let's use protection. Hey, did you know there's a female condom out there with a dental dam? That's what it's about, is getting the information out there to people, letting them know what's available to them. And I think also what I think is really important is we are hitting the community here in San Diego. I know in a lot of other communities, we have outreach workers, but really we need to start looking at the data and knowing strategically where we need to have community-wide or public service information available. And we're going to be out in the community. We will be at Del Mar Fair, out at the fair, this coming Saturday, June, what is Saturday? 14th. So look for the Family, Youth, and Roundtable Thrivecast table. We are also going to be at Gay Pride. I can't wait. We're going to have female condoms and lube that the Diva got for us to pass out and do advocacy. And that's going to be in July. What are the dates there?
July 19 and 20, which is Saturday and Sunday.
Saturday and Sunday, and look for us. And we will be out there we'll have beads and all sorts of stuff to raise awareness. Most importantly, I'm honored every day to come to work with you here at the Family Youth Roundtable. I feel like we're in a battlefield some days, and we are the guerrilla warfare, military men going out there, men and women going out there, and transgendered, and fighting for awareness, fighting to have a voice, and having other people who feel disenfranchised know that they can come somewhere and talk. And most importantly, I look forward to the future working with you, because I know when I come on full-time and you come on full-time July 1st, we are going to take this community, this state, and this nation by storm. because what we're doing is needed, and we need to clone ourselves, and we need to bring more people into our outreach guerrilla initiative, and most importantly, that we create change for people that sometimes aren't heard. So, all right, sister, I will talk to you soon. Next time we have to have Hector on, because the two of you together are so much fun, and Hector would do a heck of a better job interviewing you than I do. And eventually, we're gonna. You just wrote a grant, actually.
The Elton John for HIV/AIDS.
We haven't gotten it yet. But
No.
What is the grant for, and what are you advocating for through the grant? I mean, this is a time to pitch it, so.
It's for HIV/AIDS within the LGBT community. And what I'm trying to do is kind of start like my own like radio broadcasting.
Right.
And
through Thrivecast.
Yeah, through Thrivecast. And I also want to start like doing providing HIV services here as well.
And what that also means to our community is if we don't get the grant, then we need donations, because I think it's important that we create. I think, Donna Marto and I have talked, is that the more that we can build this to talk about family and youth, underserved, foster care, adoption, living in poverty, living in low income status, the stigmas that are out there, the more that we can broadcast the story, the message, the social and emotional success stories of navigation and how to be well, even in perseverance of trauma and tragedy. That's what we want to do. And I know that you and Donna worked on that. Donna, the CEO of the Family Youth Roundtable. Watching you together in the room is awesome, because she is teaching us how to create and look at grants and how to go about it, and we may fail in the process, and we're going to learn from our successes, but that's what this is about, is creating a community learning environment. And I hope that eventually we have a network that actually provides all the tools and everything everyone needs, depending on the population that they identify with. So that's our goal, and for everyone else, we will see you next week. And I will have Priscilla on here shortly after we do Pride, to talk about Pride. And hopefully we'll have Hector, and maybe we'll get a little mini roundtable together to talk about youth, family, and some of those initiatives as well.
Yeah.
All right, cool. All right, that's Thrivecast for this week.